Welcome back to Dwindling DS Diva. I'm Amber, and today we're going to talk about my last requirement for my insurance approval. So in my last video, I talked about all the different prerequisites that were required, and I said there was one more thing that I had to do in order to get that approval. So today we're going to talk about that one thing, which is an endoscopy. So an endoscopy is a procedure where they take a camera and they put it in your mouth while you're asleep, and they put it down your esophagus and into your stomach so that they can look around and see what's going on. So obesity is actually a risk factor in a lot of different digestive diseases. So this is a good way for your surgeon to take a look, see what's going on. It can help to answer a lot of unexplained symptoms that you may be having. The reason that your doctor may perform an endoscopy is your current symptoms that you're experiencing, any weight loss failures that they may have evaluated, and any management of complications that you may be currently having. So, I know that I've talked a little bit about the different things that I've been experiencing. I do suffer from GERDs, which is gastrointestinal reflux disease, which is basically like heartburn, but it happens frequently and it's really intense. I get this horrible like stabbing pain in my stomach. I don't really feel a lot of burning like up here, which I thought was odd. When I saw my old GP before and I told him the experience that I had, and he told me it was heartburn, I was like, there's no way it can be heartburn, because I remember the first time I experienced it, I went out with my husband and we went out to eat with our cousins and their kids, and I had a salad. Nothing that you would think would cause, heartburn. I had a salad and it was awful. Like, I can't explain the pain. It was so bad. The stabbing pain was so intense and it did not let up. Like, it went on for hours and hours, to the point that I actually forced myself to throw up because I thought that would make me feel better. And I just puked up salad and still felt awful. And that's when I decided I needed to go to see my doctor, because I thought maybe I had like an ulcer or something, because it was just so painful that I thought something was really seriously wrong with me. So you can find causes of unexplained symptoms like persistent heartburn. You can find the reason for like bleeding, nausea, vomiting, any pain or problem swallowing, any unexplained weight loss. And so they really like to perform this prior to bariatric surgery, because a lot of these different issues that you may be having can pose a big problem for post-surgery bariatric patients. And it can also find some abnormalities from test results like anemia or nutrition deficiencies that you may have. It can identify many different diseases like anemia, GERDs, which is that gastrointestinal reflux disease that I have, ulcers, cancer, swelling or inflammation that you may have like in the esophagus, different abnormalities, celiac disease. So they perform this before you have your surgery. So they may actually want to perform a biopsy on you. And what they do is they take a small instrument and they stick it in the endoscope, and it goes down into your esophagus and stomach along with the endoscope. And then they just snip off a tiny piece of tissue that they can test for different diseases. And so my doctor did tell me that they will be performing a biopsy with mine as well. So when they perform the endoscopy on you, you can expect to stay in the hospital for about 1 to 2 hours just to let the sedation wear off. And then you'll also need someone that can drive you home. So you can't drive yourself home, so you need to be prepared for that with your person to take you home. You also are going to need to relax and just rest for the rest of the day, so you can't go back to work, which is unfortunate. I wanted to return to work, but I was told that that wasn't an option, so I had to take the day off. You can expect to have bloating, nausea. You can expect to have like a sore throat for a couple days. And that's pretty much the gist of what you can expect after the endoscopy. It's a really simple procedure. It's not a big deal, so it's nothing to really worry about or get worked up about. So, also when they do the endoscopy, they typically look for what they call a hiatal hernia. So, when they stick the camera down there, they're checking to make sure that you don't have one of those, because that can cause a problem as well. They stick the endoscope down your esophagus into your chest where your diaphragm is. So that's where like your lungs are, how you breathe. And then it goes through a small opening called a hiatus. And then it goes into your abdomen where your stomach is. So with the hiatal hernia, they're actually checking to make sure that you don't have the top portion of your stomach bulging up through that large muscle that separates your chest and your abdomen. So that's basically what a hiatal hernia is. It's just when the top portion of your stomach pushes through that large muscle. And they can actually fix that when they perform bariatric surgery as well. So if you have one or you're afraid that you may have one, don't worry, it can be taken care of as well. And so we are going to go in for an endoscopy, and they're going to take a little biopsy of my stomach or my esophagus, and we'll see what's going on in there. So thanks for joining me again, and I'll see you in the next video. Bye.